Hey y'all, it's Morgan, one of your hosts of the Connections podcast. On today's episode, we have Erin Bowman, the CEO of one of our state-operated facilities here in North Carolina. Today, we're going to be talking about how our state is leading the way and how to really give high-quality care to those who are the most vulnerable. Let's hear what she has to say.
Welcome to Connections, the podcast from addiction professionals of North Carolina, where we explore the nuances of addiction and mental health through the lens of policy and practice.
We're your hosts,
Sarah Howe
and Morgan Coiner, and we're here to help you see how it all connects.
And today we are coming to you live from the APNC 2024 Spring Conference. We are doing a live recording with audience members from our conference. We are so excited to have you guys. This is a dream for us that we have the opportunity to have many of you here in the audience, as well as to have some of our guests that we wouldn't often have the opportunity to talk to live. So thank you all for being here. Thank you to our listeners. We're going to jump right into it and introduce our first guest, Morgan.
We are here today with Erin Bowman. She is the CEO at Julian F. Keith Alcohol Drug Abuse Treatment Center in Black Mountain, I believe. Mm-hmm. It is one of our state-run facilities. Erin, welcome.
Thank you.
Yes, thanks for being here. As we get started, can you just tell us a little bit about JFK and the work that y'all do and the place that your facility has in sort of the greater behavioral health system in our state?
Yeah, so JFK is, like you said, a state-run substance use agency, and we do detox and rehab there. JFK has been there for about 53 years now, so have served the community for a really long time and is a really, integral part of the continuum of care there. So we've always served patients who have, no funding, Medicare, Medicaid, and now we serve more with kind of private insurance. But primarily since Medicaid expansion, we are serving probably 80% of our folks have Medicaid now, which is really exciting for us. So we really want to be able to be that safety net provider for people who don't have, the care that they need. So really, we're also an opioid treatment program, one of the only two inpatient opioid treatment programs in the state. So us and Walter B. Jones. So Walter B. is our sister facility in the eastern part of the state. So we serve about half of the state and they serve about half of the state. And we really just make sure to focus on evidence-based practices, make sure that we're doing everything that we can for people who generally couldn't afford inpatient care to be able to get the best services that they can. So we really want to focus on, having the highest standard of substance use care that we can.
So you mentioned that now a lot of your patients are Medicaid eligible. We just expanded Medicaid December 1st.
So
super exciting to hear. So has that impacted you all? Are you seeing more people coming in that have eligibility? Are you seeing more people ask for services that you might not have before?
Yeah, so we've really almost completely flipped. So it was almost opposite of that. State-funded folks, so indigent folks who had no payer source, and now we're seeing the direct opposite of that. So, and we are actually signing people up for Medicaid when they come in if they're eligible. So we've seen a huge portion of our folks be able to sign up for Medicaid when they walk in the door, which is really exciting.
That's really that did not take long for you to see that.
I was going to say it's barely been 6 months.
Yeah,
it's December 1.
It's been pretty exciting. For us, we've been waiting a long time for that, and it really expands the services that these folks can get. So.
Well, and I think it underscores what we were telling the legislature, that there are people in need, that they don't have the ability to get those services if they do not have coverage, and that many of them, once they know they have the coverage, will come in, or those that don't know they're eligible, there is a way to get this covered. And so I think as we talk to the legislature about, hey, is Medicaid expansion working? You're living proof already.
It's working.
That it's working.
It's working. Yeah.
That's exciting.
Yeah. And then it affords them so many opportunities after they leave that they wouldn't have had before too. So, we see ourselves as a real integral part of helping people get the services that they need. So signing them up for Medicaid and then being able to, access greater services once they leave.
And I think my favorite part about JFK and Walter B. Jones is y'all are living proof that the quality doesn't have to be compromised based on how much you can pay, right? Like there are some, we know what like the stats look like, right? There are a lot of people with substance use disorders who cannot afford treatment. No. And there are places, unfortunately, that they go that don't have that same quality standard. And so the fact that we have these 2 facilities in our state that are providing top line care for people who can least afford it is, I think, incredible.
Oh, absolutely. Absolutely. And not every state has that opportunity.
No, they don't. And North Carolina, has continued to support these agencies, which is really important, and like you said, I think I'm going to brag a little bit, but I think that we would compare to really any inpatient substance use facility. And in fact, because we, are focused on evidence-based practices and making sure that we're staying up to date with all the science, because as things change, you have to change, and I think our field has been slow to do that sometimes. And so I'm really excited that, we get the opportunity to see something change and learn more. As we learn more, we have to do better, so I think that our agencies can do that, being supported by the state. We can really say, this is an evidence-based practice. We're going to get training on this and we're going to implement it in our facilities. And so I would put us up against really any inpatient facility. And we think that our patients deserve that care the same as anybody else.
Yeah, and they do. Yeah. You're right about that. Talking about that evidence-based practices, one of the things y'all really are on the front lines of, and I know that you personally are a huge advocate for, is integrating peers into a number of different pieces of the treatment process. Can you tell us a little bit about the work y'all are doing with peers right now, JFK?
Yeah, so we actually have some people in the audience who were some peers at JFK. But so I would say JFK has been a place, and Walter B. too, who have always had kind of what I would call old school peers before there were really peers. So lots of folks who have come through our facility and then started working there. So we've got people who had come through 20 years ago and still work at our facility, but we really wanted to integrate certified peer support specialists. So our education department, most of them have become certified peer support specialists. And then we really focused in our outpatient clinic on peer support. So we recognized there was a gap in when someone was referred and then when they left, right? There are those pieces where people can fall through the cracks. And so we really wanted to connect peers pre and post discharge. And so our outpatient clinic connects peers with people before they come in, while they're waiting to get into the facility, and then after they leave to make sure that they've got both of those places covered. And we've seen great success with that. I think the peers make such a huge difference, and they're really they're able to connect on a way that, other folks can't. And I think that we have seen some really great evidence of it working. One of the things that we've seen, and it's interesting because people worry a lot about, and it's kind of like a term I don't love, but recidivism, right? People coming back into the facilities. Well, one of the things that you see, though, when you integrate peers is that they actually come back quicker, which is something we would want, right? Like, you want this to be identified if there is a return to use. Yeah. And so sometimes you'll see a return to use, the peers catch it and they connect with them and then they get them back into care, which is, great for everyone, for the community, for the patients. It's working. So we worry a little bit less about recidivism, more about that connection and making sure that we're identifying when people need the services and really getting to them quicker and making sure that their lives aren't falling apart completely before they get back to that next, next day.
Yeah. When I worked in treatment, we often had the question like, well, what does success look like at your facility? And then we had like a 20% return rate. Yeah. And we always said, like, they felt safe enough to come back and say, like, this is happening again, like that, whatever, led to that return to use. And I was like, I will never say that that's not a success, that someone wants to try again. Yeah. Like, we know that it often for many people takes more than one try.
Yeah.
And I think the other part of this conversation, we've been talking about it a lot this week, is workforce.
Absolutely.
Right. And the gap that we know from what we need in our workforce and what we have. And what I love about integrating peers is you're creating a whole other career path too. And we're starting to see this around the country where there's an actual career path for peers now, and the opportunity to do this work and get a certification. If you want to continue and do clinical work, you can, but you don't have to. If you really want to stay in that peer support, we can do that and have a professional path. So how have you seen that in terms of just helping your workforce, in terms of workforce retention?
Yeah, we actually just in our outpatients started working with vocational rehab and doing an internship for peer support there. So really having that peer be paid and to be able to do like an internship to learn all the things that they need to become a peer. So that's really exciting. We also have seen, a couple peers, go through and now they're going to be working our counseling department, right? So they've been there from peer through their bachelor's, master's, and now they're, going to be a counselor there, which is really exciting. So I think you're right, though. It's the whole continuum. There are people who, if we can pay them enough and we can give them enough benefits, then they want to stay as a peer. And it's a wonderful opportunity for them and the people that we serve. So I think, we've really struggled with getting the pay because we're in Buncombe County. Our cost of living is extremely high. I think it was $22 an hour recently for a living wage. So we're really, we've struggled with getting enough money for our peers, and we're really working on that, trying to get those increases and stuff because we know the value of what they bring.
And I want to give a shout out to the NC Department of Health and Human Services because they have been really focused on this, and they have now a peer professional workforce work group. Say that 4 times in a row. But they're really working to try to professionalize, give a career path again. But then you see it now at where you're working under the department, right? That they're doing this. So we're not just having a work group about it.
Yeah.
We're actually implementing this every day in what we do. So I think that's really, it speaks volumes.
Yeah.
So especially, as the legislature appropriated $835 million, part of that is to look at peers. So just to remind any of those policymakers listening, it does work.
It does work, so, and we want to continue to expand it too.
Yep, definitely.
Yeah. I am interested. We touched on it a little bit. Treatment is such an interesting place in this continuum to work because you do, it sounds like, get to see a lot of the long-term success stories through some of your clients. But some clients come in and they leave and you don't see them again. Some clients leave and they end up overdosing and dying. What is it like for you working in a space that kind of has the side-by-side grief and joy that comes with this work?
Yeah, I think it's easier for me being the CEO because I'm out a lot in the community and I spend time, and some of our greatest successes I think are people that I'm friends with, and who have, come out and are really successful, and I get to see that a lot. And so, some of our frontline staff, it's a lot harder for them because they don't get to see that every day. They see folks who are really struggling and coming in and multiple times and really working through that process. And so one of the things that I really wanted to do was to bring people in to talk to our staff who have come through and are now, doing things successful. Mike Roberts comes in and talks. We have, other folks who will just come into our program so that they can let our staff see that too. Because I think that that's really important. They have to be connected to that. I know it works and they know it works, but I get to see it a lot more often with the crowds that I'm in, and the groups that I get to spend time with. So yeah, I think it can be really hard for people to see people that leave and then overdose, and often they're really worrying, are they ever going to see this person again, when they leave? And so, having that connection to success stories, I think, is really important.
I love that you do that for your staff. I think we do that a lot for clients. Look, this person made it, you can too. But to have that as a space you hold for your staff to say, hey, this might not have been your client, but sort of representing JFK as a whole, this is the work we do and this is the result of the work that you are doing. You're putting in the work now so someone you're treating can then come back in 8, 10, 15 years and tell their story of how this place changed everything for them. Absolutely. And I think that's a really cool thing to do for your team, especially in a workforce crisis, dealing with post-COVID behavioral health implications. we need those stories now.
More than ever.
Yeah.
It's important.
Yeah.
Well, and as we talk about healthcare too, this actually isn't groundbreaking. You know, I myself am a cancer survivor, and the first thing they did was say, here's the American Cancer Society. Here's the support group. We were talking about this in one of our other episodes that, you know, when you look at like the cancer model, right? I walked in and they said to me, here's your oncologist, here's your radiation oncologist, here's your oncopsychologist, here's your well-being. Oh, and here's the American Cancer Society, and here's those peers. And it wasn't, they were all 5. It wasn't 4, and then here's a card for somebody else. And some of those people that were in my cancer survivor group nearly 14 years ago now are still part of my life and my journey today. And so from a healthcare perspective, we've been talking about this for a long time. So for us as a field, we continue to talk about how we are a vital part of this healthcare system. Then why wouldn't we integrate peers as well? We've known this works in other part of healthcare for years. So we need to continue to remind people that this isn't something new.
Yeah.
As a matter of fact, it's part of the evidence-based process.
Absolutely.
Yep.
Yeah.
Well, Erin, we are just about at time, but I just want to say thank you so much to you for joining us, but also for the work that you do in this state, for every team member that you lead. They are doing some of the hardest work in this state on the front lines, and we are really thankful to be able to support you and be a partner to you, and just really appreciate all that you're doing for really vulnerable people in our state. So thank you.
Can I mention one more thing?
Absolutely.
I do want to shout out my team at ADAC. They are so amazing, and they're people who just work so tirelessly in a lot of really difficult situations. You know, we serve a lot of people who are very, very difficult and have difficult cases because of their history. And so they do a really amazing job, and I'm just super proud of all of them. So I obviously could not do this without every one of them. So I just wanted to say that.
So let's give both them and Erin a round of applause.
What a great conversation. I love that JFK has found a way to utilize peers that is so meaningful and that can take something that we know is going to happen, like a return to use, and make it so that that doesn't have to be a devastating blow, but that it can really just be a bump in the road on someone's full journey in recovery. Thanks so much to Erin, and we'll see you guys next time.